dog people, so it's all good.
Absolutely.
Okay, I'm going to take it from the top again.
Okay.
In 3, 2, 1. Hi, everyone. Welcome to Sandy K Nutrition, Health and Lifestyle Queen. Today with me, I have a special guest. His name is Dr. David Rankin, and he is currently Chief of Plastic Surgery at St. Mary's Medical Center in Florida and is board certified by the American Board of Plastic Surgery. Dr. Rankin practices cosmetic and reconstructive surgery throughout Palm Beach County. His main focus and passion has become breast explant surgery. His advanced training, attention to detail, and natural artistic skills help him to achieve beautiful results with his patients. Dr. Rankin has appeared in many local and national publications, including The Doctors, Inside Edition, Daily Mail, People, US Weekly, and more. And today, I asked Dr. Rankin to come and talk to us a little bit about breast implant illness, about breast explants, what to expect. And I thought, why not go directly to the expert? Because somebody in my community told me about Dr. Rankin. So I reached out to his team, and I am so happy and grateful that you came to talk to us today. So welcome.
Thank you very much. It's a pleasure to be here.
Yeah, I'm happy to have you here because, as I mentioned to you, I had recorded a show last year and there was a lot of attention on that show on the topic of breast implant illness. And I really want to hear it directly from you. And I'd like to know how you got into this specific area of plastic surgery.
So I've been practicing in private practice for going on 20 years now. When I started, I did the full gamut of plastic surgery, a lot of trauma and reconstructive and oromaxillofacial surgery, upper extremity. It's just been the last 5 to 6 years where I've really focused almost exclusively on breast explant surgery. And it just happened naturally by starting to do explants, seeing my patients get better, seeing their responses. And then I kind of had a calling to do this as my career.
Well, obviously there was a demand for it, right? Because
Yeah, absolutely.
people are talking about it so much more. And why do you think that is? Because I think we should probably define what is breast implant illness.
Well, breast implants themselves are not lifetime devices. So that's number one. Number two, breast implants may cause health issues in women, which we're finding out more and more as time goes on. That is breast implant illness. It's a multitude of signs and symptoms that women experience directly related to the breast implants. We don't really know at this time what the cause is. We're just seeing more and more women affected. It's important to state that not every woman is affected by their breast implants, but it's the ones that are or have problems or complications. Those are the patients that I find in my practice.
I don't know if you would have heard of this, but the first time I had ever even heard of explant surgery was from the Real Housewives of, I think it was Beverly Hills. Yolanda, she's one of the famous models, and
Yeah.
she went through all these problems, and it was like, she talked about it nationally on TV, and I'd never heard of this before. So, it's interesting because a lot of women don't want to believe that some of their symptoms might be associated with the implants. So maybe we should talk about, what is the safety profile? What kind of implants are used now?
Most of the implants in the United States are from two major companies. There's FDA approval for those here. In other countries, we find different types of implants, but predominantly they're either a silicone implant or a saline implant. They're both the silicone and saline implant. They have a silicone outer shell. The saline is filled with saline solution, and the silicone is filled with a silicone gel. So those 95% of the implants that are implanted in the United States are from those two types and those two companies.
And do you find, do they have the same warnings? Because I had also learned that there is a black box warning on implants. Is that
Yeah,
true?
yeah, it is true. That's recent. They have found in some women in the scar tissue that forms around the implant, certain type of cancer formation. They're very rare, so we don't want to alarm every woman with breast implants, but it's a possibility. So it's something important to know. Also, they've found that women are experiencing some systemic symptoms, which are symptoms throughout the body affecting their health. We don't know the numbers yet of what percentage of women are affected and what are not. So we're trying to elucidate those things as time moves forward.
What are those symptoms? And is it more with the silicone or the saline that are these symptoms are experienced?
Yeah, in my practice, my explant practice, I probably remove, I'd say, more silicone than saline, but I'm seeing issues with both types. The symptoms, there's really a multitude. If you look now on the Food and Drug Administration website, they list the most common symptoms of breast implant illness, which are joint pain, fatigue, memory loss, hair loss. There's quite a few. In my practice, I see quite a few more, just anecdotally throughout my patients.
So I guess the a pretty big question is how do you know? How do you know? Are there any tests that can be done before you actually undergo surgery?
Yeah, unfortunately, there is no test for breast implant illness or BII. It's a diagnosis of exclusion. I think when women are having issues, first thing they need to do is get checked up by their normal practitioner and do a workup for any other causes that may be leading to these problems. If nothing can be found and my patient is still having a lot of issues, many of them make the choice to remove their implants and see if that improves their health. And lo and behold, in my practice, I find most of my patients do have improved health once they explant.
See, that's the key right there. Is that I guess you follow your patients to see how their symptoms are afterward.
Absolutely, absolutely. I try and follow most of my patients at least up to a year. And the majority of patients, when I say, how are you feeling? Do you feel better? I'd say 85% plus in my practice do feel better after explanting, sometimes very, very significantly.
Wow, that's interesting. Is autoimmune on one of those autoimmune conditions on one of those warnings, or is that just something that people are talking about?
It is. We know that there is a correlation. If you look at the very fine print in some of the manufacturers' own handouts, you can see some of the autoimmune diseases that have a higher incidence with patients with breast implants. Whether or not it's causing autoimmune or it's just exacerbating a predisposition, we're not 100% sure.
You see, that's what I always say too. I'm always like, there's just so many factors to our health and our wellness, and everybody's so unique. So, for example, I might be a woman who is overweight. I don't exercise. I don't eat well. I eat a lot of fast food, a lot of fry. Of course, I'm going to be more at risk for anything. And then, like you said, if I have implants, that just might be like the last, I don't know how to even explain that, but that might be the last thing that just kind of triggers the offset of many issues and diseases.
Yeah, it can be a tipping point. And I see a lot of my patients, they really have fine-tuned their health. They've seen their doctors and naturopaths and take supplements, and they're able to maintain their level of health, basically. It's patients that, like you said, are unhealthier and not exercising and not eating good foods. They have a more of a propensity to develop problems, I feel.
Well, it makes sense. And then I guess it's two different. I'm the way I'm looking at it as a non physician is I look at it in two different ways. There's the symptoms, and then there's the fact that you might actually see something. You might physically see something wrong. Like, I mean, listen, everybody who's on TikTok has seen those surgeons that show explanted implants with the casing and the scarring. And, can you actually physically see something and then you go, oh, yeah, okay, that explains it?
In some patients, you can. So on the flip side of non-breast implant illness related issues that women have that makes them want to have their implants out are things like ruptured silicone implants, ruptured saline implants. Calcifications is when you get a calcium shell that forms around the implant. Capsular contracture, which is where the scar tissue around the implant kind of goes crazy and squeezes and causes pain, and a misshapen breast. Also, women that have had 5, 6, 7, 8 breast surgeries, they've gone bad. They've had infections. So there's a whole multitude of things that make women say, "I want to remove my implants." Then on top of that, now we have the possibility of having symptoms directly from the implants themselves.
Right. And how are those issues diagnosed? Do they do ultrasound? Like, what do they do? MRIs? How do they find out if let's say there is a rupture?
Rupture diagnosis, the best thing is an MRI. It's almost 100% conclusive. A step down is ultrasound, which is also very good, but not quite MRI level. And a mammogram can sometimes differentiate a rupture as well.
I have to ask you this. Are mammograms safe for a woman who has implants?
Well, I mean, there is a possibility of rupturing an implant with a mammogram. I think as a woman, breast diagnosis, breast care, safety, evaluation is just extremely important. So I would never tell a woman, don't get a mammogram. I would say to speak with your breast practitioner,
Yeah.
and say maybe an MRI, maybe ultrasound would be a better exam for some of these women, particularly with thin breast tissue or capsular contractures. So there is risks involved, but diagnosis of breast cancer is just, we know how important that is for women.
Of course. Of course. So if a woman has implants, it doesn't necessarily mean she's at higher risk for breast cancer, unless it's that specific one that you mentioned.
That's correct. We have not found a higher risk of breast cancer in women with breast implants, unless it's of the ones that I was speaking of, that can be a cancer diagnosis of the capsule itself. But again, very, very rare. We don't want to scare people on that.
Yeah. Yeah. Okay. So I know a lot of women in my community who are extremely health enthusiasts. And, some women might say, well, I do everything. I don't see why I would take my implants out. And then some are starting to research and read more about this. So, if you have no symptoms, would you say that there's really probably not a lot of risk?
I would tell a woman if they came into my office and said, I have implants, I like the way they look, I'm very healthy, and I feel great. What do I do? I would say, just monitor your health. If you have a silicone implant, there's some criteria for getting MRIs every number of years, ultrasounds every number of years to make sure they're not ruptured. But I think in those patients, they shouldn't rush to explant. If you've had a silicone implant for a number of years, and different plastic surgeons have different numbers, 8 to 12 years, those women do want to probably at least make a change. I don't do any implants in my practice, but they want to consider doing something in that time. Saline's a different story. Saline implant, like the way they look, no symptoms, healthy woman, should just monitor.
Okay, so it just sounds to me, I don't know because I don't have implants, so I just hear from other women. So is saline just less riskier, would you say?
Well, to a certain extent, yes. If you get a saline implant, you can keep them in much longer term than a silicone, not worrying about silicone gel leakage and rupture and not knowing. If a saline implant ruptures, a woman usually finds her breast goes smaller right away. So you know there's a rupture and it's saline fluid, it's not silicone gel.
Right.
In my practice, and we don't have the specific numbers of silicone versus saline, I see less problems with a saline implant than a silicone. With that being said, the silicone implants clinically, it's a better feel. It feels like more of a natural breast. There's less chances of rippling or palpating the implant. So there's definitely pros and cons of both. But I think if you ask me which one was safer, I would personally say I think saline is a better choice.
Okay. But silicone might be a more popular choice.
And that is correct. And it is a more popular choice. I believe in Europe, it's approaching 100%, and in the United States, it's gone way higher since they were put back on the market in 2006.
So they were taken off for a while.
Yeah, there's always been some questions of problems with the silicone. We've been through it and been full circle on these things for many, many years. So they were taken off and saline was only available for a number of years. And then they were put back on the market in November of 2006.
Okay. So, I mean, I'm okay with going a little graphic, but have you ever been shocked in a surgery when you go into surgery to do an explant and it's just much worse than you expected?
Absolutely. It's usually just really bad ruptures of older silicone implants. The older implants were more of a liquid consistency. Patients that have had hematomas or bleeding inside the chest cavity, and that blood sits a long time. Those can be really messy surgeries also. More often than not, the implants, they look okay, they look normal, that I remove. I do a lot of ruptures also, but the shocking ones are, in my practice, I see them more often than most doctors because I do a lot of explants, but those are more rare.
So then your job as the surgeon is to clean up whatever's in the area as well. Like you have to, like you're saying that they can be pretty badly ruptured and hematomas, like you have to clean up the area. And is that even possible? Is there long-term damage?
Well, usually when an implant first ruptures, your body has already formed scar tissue around it. We call it the capsule, and it's your body's way of walling off a foreign body. It's saying, there's this foreign body inside me. I'm not sure what it is. I'm going to wall it off. So most of the ruptures are contained within that scar cavity. So if you can take out that scar cavity along with the implant and along with the ruptured material, you try and make sure that there's no contamination of the breast tissue if you can.
Mm.
Beyond that, you're right, cleaning out a lot of irrigation with antibiotic solutions and things like that as well is done on every patient as well.
Okay. Now, I have to ask about fat transfer because every single woman I know is afraid of what she's going to look like after she has her breasts removed,
Yeah.
her implants removed. And like the fact is that your skin stretches, and if it's a woman who's in her 50s, well, the skin is not as elastic as it was when it was, when she was 30. So what happens then?
So many of my patients, I offer a breast lift or skin tightening at the same time as the explant, because you're right, you've stretched tissues, you've removed volume, things tend to want to go south. So a lift at the same time is sometimes a good tool that we have. Every woman is different in regards to possible outcomes. The more difficult patients are patients with very thin or little breast tissue, patients with really large implants. Those are more challenging patients. Some patients, the majority of patients, turn out very well. Other patients are more challenging, and you do have to talk afterward about things like revisions, fat grafting. Fat grafting is a nice tool to have to do a couple different things. It can fill in an area that has a depression. It can add volume and fullness to the breast, but it's very different than a breast implant. With grafting, you can maybe get a half cup size, maybe a cup size bigger, but it's more of volumization of the breast. It's not an implant type of look usually.
Right. And where does that fat come from? Does it come from does it have to, what if a woman's really thin and doesn't have the fat?
Well, it has to come from you or an identical twin, but that doesn't happen very often. But it has to be your DNA because it's your tissue. If you take it from somebody else, like a kidney transplant or anything like that, it's gonna fail.
Reject, right?
So
Yeah.
we usually it's traditional liposuction. We collect it in a machine that's made for fat grafting, and it's injected into the breast. You're right. The more challenging patients for fat grafting are the ones that have very little fat. I do a lot of fat grafting in my practice for patients with very, very little fat. I do have a referral doctor that I send to that he's in North Carolina, and he's kind of a magician at finding fat in very thin patients. So
I guess where would it come from? The bum, the belly?
hips, abdomen, inner thighs, outer thighs, those are kind of my go-to areas.
Wow. Okay. And I have to ask this, do you get patients who have had mastectomies to come and do like fat grafts only, or to do some sort of, obviously not implants because you don't do implants at all anymore, right?
Yeah, I do have patients that have had mastectomies that want explants. They're very challenging patients aesthetically because they have no breast tissue. It's already been removed.
Right.
Mastectomy patients also, I have not had any successes in fat grafting them because there's nowhere to really graft the fat. It's such a thin layer of tissue. So those patients either elect to go, we call it a flat closure, which we try and smooth things out best we can. Sometimes these patients are candidates for what we call autologous reconstructions. So that's moving tissue from the abdomen into the chest. It's called a tram flap. So it's utilizing your own tissue, and there's certain plastic surgeons that will specialize in those types of procedures. It's a pretty invasive, pretty intense procedure, but that's an option as well.
Do you get a lot of women who have had mastectomies come and have their implants removed?
I do, and I mean not as many as women without mastectomies, just with implants, but I have had a number of women with mastectomies. It's usually women that have had poor outcomes with their reconstructions, or the implants are very painful. They've had infections. They have a lot of symptoms. So those are the patients that I would perform that type of surgery on.
And what happens once the implants are removed? What if you have a patient that has had, pretty severe ruptures? I mean, what's the recuperation?
The recuperation's not too different than having your implants placed. And I always recommend just 3 weeks of really taking it easy. You can still walk around and move around and do stuff. And then 6 weeks is pretty much back to normal activities. I use a long-acting anesthetic called Exparel. It really takes all the pain away for about 3 days, which is the most painful. So most of my patients after surgery just take Tylenol.
Wow, that's not too bad.
Yeah. It's been it's a medication that we kind of stole from the orthopedic surgeons that use for knees for pain control, and we're starting to use it a lot in plastic surgery, and it's really been a paradigm shift in our pain control.
Speaking of paradigm shifts, do you think that that's what's going on right now in the world with I'm just seeing so many women get explants, whether they have issues or not. Like there's something changing in that, women are owning it, owning what they have, who they are.
Yeah, I agree. There is a push to be more natural. The bigger breasts are not in as much as they were in the days of Baywatch and those types of shows. So smaller breasts are more fashionable to a lot of women. They want to be back to their natural self. There's a lot of women, just taking care of their self holistically. And this is kind of part of that process. And I think a lot of it has been education and allowing women to know that this could be part of their holistic problem. Could be their implants contributing to some of the problems that they're having. So I think knowledge and education has been really key in this development.
What do you recommend for a woman after she has explant in terms of more of the holistic side? Like, do you have practitioners that you recommend they go and work with if they had complications? Let's say they had a lot of, of course, as a surgeon, you're going to clean up what you can, but the fact is that if toxins are leaching in your body for many, many years, it's not maybe as easy to clean up. What are your thoughts on that?
A lot of my patients go on and do just full extensive blood panels, full physical examination. And if there's problems in the blood or other medical issues that can be treated, then that's what we do. I think that the explant is kind of part one, which makes a lot of people feel better right away and enables them to continue on their health journey when they're feeling better, less fatigued, less anxiety, depression, and just feeling better overall.
And interesting. Is that a symptom that you see with
I
women?
do. Yeah, I
You
do
do.
quite often. Yeah. Yeah.
Oh, that's interesting. And age, is it from all ages that you see that those symptoms?
From all ages of patient or implants or
Patients that come to you with symptoms who have implants and are thinking or want to have them explanted.
um, I mean, in my demographic is from 20s to 80s, implants that have been in a year, implants that have been in 40 years. So I see all types of patients, all types of implant durations. Absolutely.
Wow. And I wonder, you mentioned anxiety, depression, those are symptoms that you see?
I see that a lot in my patients. You have to be kind of cautious with lumping everything into breast implant illness. That's really still being defined. I can only say what I see in my patient population. But there is a big laundry list of symptoms that women are self-proclaiming to experience, and I do see many of these things go away after explants.
Wow. That is really fascinating that this is coming about more and more. And actually, I'm going to say, I don't think it's a bad thing. I don't think it's a bad thing because I feel like we're coming into this world where women can age gracefully, women who have breastfed children, women who have, like the fact is that aging doesn't necessarily have to be an ugly thing and you're trying to mask it. And having implants is kind of something that happens where women feel like they breastfed children and they're not what they used to be. So they're trying to maintain that youthfulness.
Yeah, I mean, everybody wants to look better, wants to feel better. But I do think a lot of my patients that explant, they really learn to love their body, love their naturalness. And it's a progression for sure, psychologically, having implants for long periods of time. And then, you get the complete opposite after. So it's definitely a journey, but I agree with you. I think that there is much more of a push for women to embrace themselves, embrace aging. There's not as much pressure, although there still is pressure on women, of course, but
There
it's
is.
it's it's easing hopefully a little bit.
Yeah, there is. There's definitely pressure,
Yeah.
but women like myself were in this world of health span and longevity, and really it's more about what's going on inside of you than outside of you. And I'm
Mhm.
not saying I don't fall into the aesthetic side of wanting to age slower, but I think this is an important conversation to say, is it worth your health?
Yeah, exactly. And I think that knowing the risks and the benefits, alternatives, potential complications going into your surgery is really important. I think many women in the past were told implants are going to be fine, they're going to be lifetime devices, you're never going to have any issues. Well, we know that's not 100% true. So having those points in your head makes you make a more informed consent, some women may say, you know what, maybe this isn't for me.
Mm. So if you were to, knowing and seeing what you've seen, what is your advice as an expert in this area to a woman who is either considering implants or considering explants?
You know, I have two young daughters, and they know what I do, and I hope that they never get implants because I've seen the problems that they can cause in some women, and I think it's taking an unnecessary chance. I would never demean a woman for getting implants. You know, we all
Yeah.
have our, you know, our life and choices to make. As far as explanting, I think that if you're having issues that we talked about with recurrent capsular contractures, ruptures, infections, or you developed a lot of strange symptoms that you can't figure out, those are the women that should explant. I think, again, if you're doing fine and feeling good and everything's going good, it's just monitoring and working with your plastic surgeon, you know, and hoping things, you know, don't take a turn for the worse.
What are the complications that can happen after explant?
It's generally a very safe procedure. There's risks of bleeding. We call it hematoma. In my practice, it's 1%. So I do 500-600 explants a year. I get 5 or 6 hematomas. It's a trip back to the operating room. Infection is rare, but it does happen. Usually treated with antibiotics. Complication, you could say, is aesthetics, right? Everyone doesn't turn out perfect. So those are patients you really have to work with. I always try and come up with a plan of, sometimes there's small revisions, sometimes there's fat grafting. So those are really the major things that I see in my practice that are concerning.
Out of all of your patients, what would you say the percentage is of the women who are happy once it's done?
Probably 95%.
Wow, that's
Yeah.
that's pretty big.
Yeah,
It's pretty big.
it's
I
a big satisfaction.
I would love for you to, because I've heard you have quite the wait list. Is that true?
I do. Yeah, I do.
And there's only
Yeah, I
one
don't,
Dr. Rankin, right?
yeah, I do. I try. I always tell my patients that book your date if you want to try and move up, get on the cancellation list, because I have a lot of movement in my schedule. Patients get pregnant, patients, you know, can't travel, patients get sick. So we always try and, you know, move people up to their dates that they, you know, are trying to achieve.
And here's another question. If you are going to kind of give me a rough breakdown, what percentage of your patients are over 45? And what percent are the younger women?
You know, I haven't really done the math on the numbers, but I would say average patient in my practice is probably right around there, about 45.
Mm.
Uh, you know, I do have patients in their 20s, not very many. I did a patient yesterday, implants were in for, I think, 45 years. So I've done patients in their 80s. It's kind of all over the board.
And here's another thing that I always kind of, I've heard from women who have had implants. Their biggest thing is they're like, okay, well, I'm, over 50 now. And am I going to keep getting these? And I'll be like 70 and it'll be time for me to change my implant. So I think, the longevity aspect is huge.
Yeah, I see a ton of that. Patients that say specifically what you said. I'm 50, I'm healthy, I feel great. I don't want to have surgery when I'm 70. You know, I want to do this now, and be proactive. Again, that goes back again with silicone versus saline. You're more apt to consider that if you have a silicone implant, because you really don't want a ruptured silicone implant that causes a complication later down the road.
And here's the other thing that I always see, obviously, as we age, we are a little bit more sensitive to any assaults that come our way as we're
Mhm.
aging. We're just not as resilient and we have to do a little bit more. So that I've heard is another consideration that women have. They're like, well, I'm healthy now, But, in 10 years from now, what if something comes my way, even high stress? Like we all know there's that factor. And there are things in our lives that, we really don't necessarily have control over. So why add another thing to the mix that could potentially increase or exacerbate other issues that are going on?
Yeah, 100%. There's definitely more risk to undergoing anesthesia when you're in your 70s than in your 50s. And like you said, you'll have other comorbidities that can, be confounding when you go to do surgery down the road also. So for those patients, they like to do something a little sooner while they're healthy.
Hmm. This has been such a great conversation. Is there anything that we missed? We kind of ran through it pretty quickly, maybe because it's, almost 6 o'clock, dinner time.
No, I think we really covered all the major points. I think it's important to state that if you do elect to have an explant, you choose a board certified plastic surgeon, American Board of Plastic Surgery, and someone that does it all the time. So, like anything in life, experience is key. It's not the simplest surgery in the world. You want somebody with experience. So that I think is a really good talking point.
Okay. And do a lot of surgeons do mostly explants? Because I haven't heard of a ton of them.
There's more and more, as more women are wanting to have this done, more plastic surgeons are stepping forward to accommodate them. Um, I think you should find a doctor that does believe in breast implant illness also. Um,
Makes sense.
that's important. In my practice, I don't put in implants, I just explant. Not necessarily that is something that you have to look for, but doctors that just focus on explanting and trying to do the best in that regard, I think is someone maybe to look for.
Okay. And that's you can find them across the United States, Canada.
Yeah, absolutely. There's a lot of social media groups it's just all women talking about explanting and breast implants. And a lot of those groups are pretty good because you can ask other women their experience that they've had. And it's good to have a referral from someone that's been through the process and been to a doctor that has done a lot of these.
Yes, I've heard your name a few times, so that obviously means something because I'm in this whole world of holistic wellness, and people are talking about you, Dr. Rankin. So that's a good thing.
It's awesome.
Yeah. So where can we find you?
So on Instagram, I'm David Rankin M.D. And that's really my main source of information. I also have a website at davidrankinmd.com as well.
Okay, that is perfect. Thank you so much for your time today. I know you're a very busy man. I really appreciate you coming and speaking with us.
It's my pleasure, and keep doing the great work.
Thank you. Okay, I hit stop on that.